Deputy Speaker, I rise with great pleasure to support this motion to recognise the work of St John Ambulance on the 135th anniversary of its establishment in Australia. St John Ambulance is a globally respected organisation that has been involved in every natural disaster in Australia over the last 135 years. Whilst their presence is a standout at our local events in the Narungga electorate, regularly assisting at events such as the Kernawick Lawenda, the Cavalcade of Cars and the YP Field Days, as well as being at a number of sporting events and concerts, in fact anywhere a large crowd gathers, the largest recent assembly of St John's personnel was their invaluable assistance during the Pinery Fire of 2015. This was the largest disaster that has faced the people in the Narungga electorate in recent years, and it claimed 2 lives, hospitalised 16 people, 5 with critical injuries, burnt 82,600 hectares, destroyed 97 homes and damaged a further 49, destroyed 546 sheds and outbuildings and 483 vehicles. 18,000 sheep were confirmed lost, 600 other stock lost, 54,000 poultry lost, and $30 million of crop, hay and straw were burnt. To give an idea of the scale of the event, the fire started at Pinery, 70 kilometres north of Adelaide, and rapidly spread to Mallala, Wasleys, Roseworthy, Freeling, Tarlee, Hamley Bridge, Daviston, Greenock and Kapunda. Appliances came quickly, and then incident management teams. The State Emergency Centre was activated, command centres were set up, strike teams and first aid posts were activated, and due to the support of and involvement of in the State Emergency Plan, in came St John's Ambulance personnel. There were 88 volunteers on duty who donated 775 hours of assistance, including 28 clinical treatments and 122 non-clinical presentations. Apart from helping on the ground, they launched an appeal in partnership with Bendigo Bank, which ultimately raised $85,000 for the fire-affected community. The funds were used in partnership with St John Ambulance towards the following projects, Mr Deputy Speaker: to fix fire awareness signage on major arterial roads in the region, to provide 6 defibrillator units for CFS groups in the region, 2 St John first aid training sessions, which included mental health first aid training, events in the region including 2 women's resilience events and a number of other things, Mr Deputy Speaker. The St John Ambulance motto is "For the service of mankind", and the charity organisation dedicated to helping people in sickness, distress, suffering or danger has certainly lived up to its motto throughout its 135 years in this country. There are 32 divisions of St John Ambulance in South Australia, including 2 in the Narungga electorate at Balaclava and the other at Mallala. In addition to the many hundreds of SA's major and local community events attended by the St John Ambulance personnel every year, a landmark project was commenced in December 2017, which is deserving of a special mention. The Every Heartbeat Matters campaign this past year saw the first 104 of over 300 publicly accessible automated external defibrillators deployed across regional South Australia by 30 June 2018. This project is set to continue over the next 2 years, aligned with the St John Ambulance mission to build more resilient communities. I am pleased to advise defibrillators have already been rolled out on the Yorke Peninsula, Mr Deputy Speaker, as well as across the Hills, the Barossa, the South East and South Coast and Kangaroo Island. With stats showing only 1 in 10 people survive a cardiac arrest outside of hospital, Every Heartbeat Matters campaign aims to markedly improve outcomes of cardiac arrest, and is particularly important in regional areas where access to emergency medical attention can be limited by the tyranny of distance. Aside from its volunteer hours at events and disaster incidents, St John's Ambulance is renowned nationwide for its excellent delivery of valuable first aid training. Its provision of first aid kits and merchandise is well appreciated by a number of different community groups, and its youth engagement programs resonate strongly with those who attend and leaves a lasting impression on the importance of first aid and safety. In the last financial year, this charity non-profit organisation attended 2,324 events and emergencies and treated 18,931 patients, attended to 533 community care clients and trained 8,197 school children in first aid. A tremendous effort, Mr Deputy Speaker. Their education and public training programs do not just cater for children. They offer adult instruction certification courses in workplace first aid, advanced resuscitation, advanced first aid, automated external defibrillation and remote first aid and occupational first aid. Indeed, they issued over almost 49,000 public training certificates in 2017-18. The same year, they sold over $2 million worth of first aid kits and equipment to SA homes, workplaces and for placement in cars. This important motion provides a good opportunity to thank the 677 St John Event Health Service volunteers in the state, along with the 507 cadets and juniors, the 462 community care volunteers, the 112 staff and 30 Historical Society volunteers for all they do and the difference they make to the lives of South Australians. And I'd like to take this opportunity to also touch on the volunteer ambulance operators in the electorate of Narungga, of which there are a number up and down the leg that do an outstanding job providing what is a difficult and often intimidating, I imagine, task, working in testing and trying circumstances. I cannot thank those volunteers enough. I know it's difficult at times to attract new volunteers, and I'd like to also extend a thank you to those people that work tirelessly to recruit new people to the cause. It must be, I imagine, a difficult balance to provide training that's wholesome enough to ensure that cadets or new ambulance volunteers are capable when they arrive at emergency, but also make sure it's not too onerous to deter potential recruits from joining the service. So I'd like to congratulate all of those people that volunteer across the YP and provide ambulance service where there is no where there is the need for it to be provided. I'd like to also commend all who commit to the extensive necessary training that is required to be involved in St John Ambulance and who give up treasured time away from home, workplace and family to assist people in need at the height of disasters such as the Pinery Fire and for the event, health services and community care programs they deliver. The state would be a poorer place without you, and I commend this motion to the House.